together a conference last year with the Auto ID labs looking at big data and serialization. Big data is one of the topics du jour, one of the popular areas on campus. There's a lot of big data analytics comes around trying to understand what was happening when you look at a massive amount of data. And it turns out that if you keep track of serial numbers, they can be very helpful to organize these massive amounts of data. So rather than running recursive algorithms and reverse clustering, trying to understand what the data represents. My favorite example of this, there was a project that came into the Sensible City Labs from GE. GE Healthcare had one of the largest longitudinal records of patient records in the country. And so the question was, could you take that data and visualize, say, for example, the spread of disease? Sensible City Labs does a lot of work around visualization in space. And so could you watch the flow of disease? Well, it turns out if you don't track individual patients, then if you have a data point that says somebody went to the hospital here with this disease, and when we're trying to track it, this is the flu virus, so here's somebody with the flu, and then the next day, next door, or in the next town, somebody else comes in with the flu. The first question is, well, was that a same person or a different person? And so there was a lot of analysis that had to go into guessing around what was actually happening. And of course, if we've been able to track the individual from day one, like much of the smartphone data that's out there that we can analyze now, has those unique identifiers. And so it's a very, very powerful key to layers and layers of data about people in the world or products in the world that surrounds them. A perfect example of how transformational this technology can be was given by Abidar, who is the CIO of the e-commerce division of Walgreens, which is now the largest pharmaceutical merchant, certainly in the United States and implicitly in the world, right? And they came up with a very simple cell phone application so that you could either optically scan, or potentially you could use an NFC reader if there were NFC tags, but scan a medication so that you could automatically reorder your prescription. And this has been a very controversial area. There's a great deal of important considerations about patient privacy, physician-patient confidential interactions, who owns the data? Is it the doctor? Is it the hospital? Is it the patient? So there are many, many questions around healthcare data. And actually in the United States, we have a law against a national patient identifier, specifically out of concern that somebody's health data might, that releasing that information might jeopardize their ability to get insurance, this type of thing. And what Abidar shared was my dad has been in an elder care facility, and I've gone and I've renewed his medicines. And each time there's 15 pieces of paper you have to fill out. It's a laborious process, and you think of all the pharmaceutical retail chains, all the paperwork that has to go into this. And what they realized is by simply scanning by authenticating from the cell phone, they know the cell phone number, maybe you put in a passcode, but they pretty much know who you are with your cell phone. By scanning the barcode of the medication, this is a serialized code that takes them directly back behind the firewall to their prior order. No information ever surfaces on the cell phone. It's all done at the back end. Today, at Walgreens, 40% of their customers, the ill, the elderly, the sick, 40% of their customers reorder their products using that smartphone application. I was part of a team that received a translational medicine grant at the Brigham and Women's Hospital in a project that's led by Dr. Adam Landman, who's a physician there, also wears the hat of one of the CIOs for the organization and also teaches at Harvard Med. But there the project was to take some of the new devices with built-in RFID readers, in this case the near-field HF RFID reader that comes in many of the smartphones today. So the Google Nexus was the platform that we chose. And to look at using that device for collecting the data at the tail end of the pharmaceutical supply chain. So we've talked about the Center for Biomedical Innovation, which is at the front end of the supply chain, and all the data inputs from the physical world that go into manufacturing a product. But equally important is when that product gets to a patient, making the association so you could possibly, subject to patient privacy, physician and hospital buy-in and so on, so that you could actually look at whether the product did any good, so that you could feed that back into the innovation cycle and get that data back to the people developing new drugs. So to do that, you need to be able to associate identifiers, just like Walgreens is able to associate a patient and their prescription renewal. And so in this project, we brought in, we did sort of like the time motion studies in their simulation center that they have at the Brighams. And so we had experienced nurses who have been using these big computers on wheels. They have the big scanners that sit on top of a big laptop that's then on a stand. So they call them computers or workstations on wheels. Our informal name for the project is put the cows, the computers on wheels, out to pasture. Because they have to wheel these things around, and actually one of the applications for RFID active tags has been to put them on the workstations, because the nurses will hide them because they need them when they do their rounds, but then there's not enough of them to go around, and so hospitals want to know where they are. And so it's been a really fun project. That work will just be going to publication, so you'll see some public information about it once the publication is done, that just shows potentially how impactful that is, should a pharmaceutical manufacturer wish to have their product information recorded. And part of the whole idea behind this Internet of Things space and all these instruments and sensors is to make the process of data collection, to make the computing process integral with the work process. So very often what our IT systems have done today is they're our worst enemies, right? Because we have to do our process and then we have to do the IT thing. And so part of the opportunity here is could you, through the use in this case of smart devices, could you integrate the IT data collection process integral with the workflow?